Picmonic is a quick and effective aid to help you pass your NP boards. They utilize 2-minute videos that connect difficult-to-remember facts with unforgettable characters. By tying facts together into ridiculously memorable stories, you'll be able to retain the information for test day. They help reinforce what you learn and track your progress with thousands of built-in rapid review multiple choice quizzes. The use of the intelligent space repetition algorithms automatically adjust to your learning needs, so you'll be reminded to review the right information at the right time, increasing long-term retention. Picmonic is also integrated into the True Learn question bank, so you can study exactly what you need and test your knowledge. Check them out today if you're preparing for board. Link in the show notes. Attention all nurse practitioners and NP students, are you tired of feeling the disconnect between clinical rotations and didactic teaching? Say hello to Success NP's clinical booklet guides.
As NPs ourselves, we know how valuable it is to have a resource that helps bridge the gap between clinical and class. So we created the digital resource to do just that. Our clinical booklets cover 5 major NP tracks: psych, adult, peds, family, and women's health. Success NPs wants to create tools and provide support NPs need to thrive in their careers.
So why wait? Check out our Success NP Etsy shop, linked in the show notes, for our digital guides and other digital clinical resources. Hi, welcome Success NP. We have another episode of our podcast today with the amazing, the illustrious, my dear friend, Sarah Lorenzini. She is a passionate rapid response nurse, an educator who brings energy and expertise to the nursing community. She's the host of the Rapid Response podcast, which I've been on. She is so captivating as she tells real life emergency stories from her over 20 years of nursing experience in the ICU, cardiac ICU, ER, and being the head of the Rapid Response team. She tells all these complex, beautifully written, applicable stories that you can then learn the pathophys, pharmacology, anything that the nurse needs to understand their role, especially in the acute care setting in healthcare. She breaks it down for you. She actually also has the Rapid Response Academy, which I think she's phasing out for summer, but probably coming back at some point, where she's teaching rapid response nurses how to be the best that they can. She holds a master's degree in nursing, as well as her CCRN and her CEN certifications. She just loves to teach nurses. She lives in the wonderful state of Florida, and she's got a bunch of kids. How many do you have now? Like 4, 5?
5.
Five kids. And she is a passionate mom. And yeah, she's just a friend. She's just a friend. Welcome, Sarah, to the podcast. I Could Cry. I just love you so much.
Oh, Sandy, thanks for having me on your show. I'm kind of laughing. You called me illustrious.
That just scared me. That just came out. I just let it.
Thank you for having me. It's always good to chat with you, my friend. Good to see your face.
And today, I really want to talk about an interesting role of the rapid response nurse and how it intersects with the role of the nurse practitioner at the bedside, because I think that's something that not a lot of NPs know too much about. And if they are maybe a new grad nurse that is just finished acute care nursing and is going to be kind of maybe in that setting where you're working, maybe this is her first time interacting with that role. What does that look like for her?
Like for a nurse practitioner that's just starting.
Yeah.
So I think just to back it up, let's just level set and describe what is a rapid response nurse, because I think that might mean something different in different facilities.
Let's do it.
And so, gosh, back in 2004, they decided, I think it was called the 100,000 Lives campaign, that they were going to make all these standards of care. They're going to save 100,000 lives. And one of those standards of care is there needs to be some sort of rapid response team or team that responds to emergencies at the bedside. And so every hospital gets to decide who's on that team, how they structure that team. But there is a team of people who is supposed to respond when patients are crashing. So it's not just left in the hands of, say, the one bedside nurse to manage this crashing patient. And so some facilities have dedicated rapid response teams where it's a nurse, that's all they do all day long, is just respond to and prevent emergencies. And then some facilities, it's like the ICU charge nurse, let's say, or the ER charge nurse might leave their unit and go respond to the emergency wherever it may be happening. So kind of like the 911, but on the inpatient side. So that is my role. At my hospital, we have a dedicated rapid response team. So I just respond to emergencies all day long. And oftentimes is interacting with the bedside nurse, with the patient, with the family, with the physician, with the nurse practitioner, with the consulting team. Like I interact with all those people. I think the expertise that I bring is not just my 20 years of critical care experience, but also team leadership. And I think that's the part that I would love to focus on today is just talking about how, as a nurse practitioner, it's a very quick transition from you're a bedside nurse to bam, now you're in charge. You're the one that's ordering the things. You're the one that everyone's looking to for guidance. And I mean, I haven't been through MP school, but from what I hear, there's not much training about that particular aspect of your role. Like you get really good at understanding which antibiotics to order and the diagnostics and like all of that. But like, what about when the patient's crashing and it's chaos in the room and everyone's freaking out? Like that skill set, managing there's no class for that in MP school, unfortunately. But that is something that I have taken years and years and years to try to perfect in my own practice. And so I love to come alongside my NP colleagues and like support them in that, give them tools and resources and verbiage really to do that very well. So I don't know if I answered your question.
No, you
but,
did.
but
Yeah. No, you did. And that's exactly how they collaborate is in those situations where the nurse practitioner is kind of leading. And what you're noticing at the bedside is that they're thrown in to these. And again, that's just so classic NP sometimes is that you're thrown into situations and you're like, okay, this is trial by fire. I'm going to have to learn, build the plane as I fly it, learn as I'm doing. And it does make it kind of hard. And there are ways that I wish, and that's part of the reason why we created the booklets that we did was because there's just so many instances where NPs are put in positions where it's like, well, why isn't anyone giving us some quick notes on like
Mhm.
what it is that we need to be doing here so that we look more prepared? Nobody wants to be unprepared, especially when you spent all this time in school, you've spent all this time in clinical, and now you're in another position where you're like unprepared. Like you don't
Mhm.
want that feeling. That feeling is terrible. What are some tools that you think that NPs could bring to the bedside as far as maybe communication? And yeah, let's start with communication in dealing with bedside emergencies. What have you noticed are some of the things that you said, this NP did this or this NP didn't do this, and this was a benefit or a hindrance?
Sure. Okay. Well, let me talk about an NP that I love so much that I think totally does an amazing job when she shows up to emergencies. And then we'll talk about something that I've seen
Yeah.
that I would recommend people not do.
Yes. Let's do it.
Okay. So one thing she does is she shows up and introduces herself. Hey guys, I'm Sandra, the NP from blah blah. Tell what's going on. So start the introduction. No one knows who you are. We're all wearing scrubs. It's hard to say who's in charge of what the role is. Introduce yourself and your role. That seems pretty obvious. I can't tell you how many people just forget to do it. Okay.
Wow.
And then she kind of like gathers information and you can see all the wheels turning in her head. And then once she's kind of like made a plan, she announces it. All right, guys. So we're going to do this, 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 and this. I'm looking for this. I'm assuming this might be going on, but I'm not totally sure. Once we get the results back from this, then I'm going to do this. So it just like basically lays out the plan of care for the whole room and for the patient to hear as well.
Wow.
Does anyone have any questions or did I miss anything? And that's my favorite part that she asks with humility is did I miss anything? Anything else I should know before we move forward with this plan? And every once in a while, someone has a little piece of information that she wasn't privy to yet. And when she hears that, she's like, oh, good point. Okay, well, let's go ahead and add this lab. Let's go ahead and like, she's so good at communication.
Yeah.
And so she lays it all out, gives everyone a chance to contribute. And then she says, is there any questions? All right, well, let me know about this and I'll circle back and about this. Like she just
Oh my
closes
God.
the loop
Yeah.
every time.
Yeah. She's a
And
leader.
everyone in the room is like, yeah, like we got this. Like we know the plan. We can move forward. I know what I'm looking for. She also thanks everyone for their contribution. That also feels really good to the whole team. And I think the bedside nurse, the family, the patient all feel like, okay, this is being managed well. So this is for like an emergency that doesn't end in like a code blue, right? That's a whole different situation. But
Yeah.
a lot of times rapid responses, it's just, oh, the patient's tachycardic. We have to manage this tachycardia. Oh, they're hypotensive. We have to fix hypotension. It's something that we can fix, right? It's not like they're about to die, but it's something we need to
Yeah.
address. And so
Yeah.
for those situations, she addresses the thing. She talks about what the plan is, what to look for. It goes so smooth. Okay, so that's the ideal nurse practitioner, right?
Beautiful. I love it.
It's beautiful. Yeah, she's amazing. Everyone loves her, right? Of course, because
Yeah.
they feel safe whenever she is present. But let me tell you, so good. Okay.
Yeah.
So here's my Most hated question. Whenever, okay, tensions are high, everyone's stressed out, something's happening with the patient, and then the provider or NP or whoever shows up and says, "Why'd you call a rapid?"
Oh, interesting.
Okay.
It's setting a different tone.
So
Yeah.
I also want to know why they called a rapid, but something about asking, "Why did you do this?" immediately puts people on the defensive. It would
Yes.
put me on the defensive, right? Now I'm questioning, wait, should I have? Is it inappropriate that I called it? I'm sorry. Like it actually makes you think like you have to defend yourself. Well, I called a rapid because of this. And they get people, you can feel it in the room. People get more stressed because they have to
Interesting.
defend their decision to have called the rapid response. There's so many other ways that you could ask, why did you call the rapid, except for that particular question? And I get it. That I also want that answer, but I'm
Mhm.
not asking it that way. I'm
Yeah.
starting with, hey guys, I'm Sarah from Rapid Response. Who's the primary nurse? Sue? Hey Sue, tell me about your patient. What should I know? There's so many other ways you can ask what's going on with
Yeah.
this patient besides why
That's
did you call the
really
rapid?
good.
Okay, so that's
Yeah.
thing number one. Don't do that. And then you do not need to start like blitzing people with questions. Give them a second to like get it out of their chest. You know, you don't have to be like, "What's the blood pressure? What's the meds? What's the history?" Whatever. They will get to it. Just give them a second.
Yeah.
It's
Yeah.
really frustrating when you have information in your head and you're trying to get it out at what you think to be an organized fashion, and someone's asking these random questions from all over the place. The other thing too is they were like, "What's the blood pressure?" I'm like, "Okay, listen, just look on the darn screen, right there. The vital sign machine is right there. Just look at it, you know? Um,
Mm.
like, what's the patient's name? Okay, it's literally written on the whiteboard right behind you. Like that. Some of these questions, like
Yeah.
you're just adding to the chaos. Just like take a
Yes.
minute, take it all in. Sometimes like the lack of emotional intelligence and reading the room, you know, like as an NP, as a rapid response nurse, when I show up to emergency, I actually act different every time. I show up, I read the room. Sometimes I'm like funny, cracking jokes. Sometimes that's totally inappropriate. Sometimes I'm like, had to be very firm because the patient's kind of wilding out. Other times, no need for firmness. This patient's scared and they need someone to be maybe affirming or like
Yes.
nurturing or
You are.
consoling, right? My tone of voice changes. I'm not the same rapid response nurse every time I show up.
Hmm.
And I think as NPs had to be aware of that too. Sometimes you show up with humor. Sometimes you should not be busting out the humor. Sometimes you show up with this kind, compassionate, nurturing voice. And sometimes that would seem kind of like you're making the patient feel like they're dumb, right? So
Yeah.
it just
Condescending.
kind of change.
Yeah.
You have to change your tone based on the
Mm.
patient's needs. Okay, so we don't say, why'd you call the rapid? We have to be aware of the room, kind of respond to the room. And then don't ask a gazillion questions. Give them a second to get it out. And then if they didn't answer what you wanted to know, then of course ask the question, right? But what I have found is most of the time people do eventually get to all the things that I'm wanting to know.
Yeah.
And then acting like people are dumb for not knowing the thing that you wanted to know,
Mm.
it actually doesn't help anything. In fact, I would say it's going to harm future patients because if they are afraid to speak up and share concerns and let you know about the patient declining because of fear that, oh, the condescending NP is going to make me feel dumb, they won't call you. They'll wait until the patient's really, really bad to let you know. And so that means future patients are going to get your care delayed. And so I would rather, even if in my head I'm thinking, how do you not know this? Or like, I'd never say it out loud. I never say it with my facial expressions. My tone is always, thank you so much for letting us know. Like, thank you so much for advocating for your patient. Even if you don't have all the information, even have all the answers, you recognize something was up. So thanks for letting us know. Even times when like, this is not even an emergency. This patient's fine. You know, maybe someone said the nurse is overreacting. They're not overreacting. They're just reacting to whatever triggered them for this patient, and that's fine. So I say, thank you so much for letting us know. I actually feel okay about this patient's presentation right now because, and then explain yourself, provide some teaching, right? But to say, like, this is an emergency. Why did you call this rapid? This patient's fine. All of that condescending stuff, it doesn't help anybody. It makes you look like a jerk, is what it does. And then the whole room is going to be questioning the future. Should I actually call Sarah? Because last
Person.
time she was
Yeah.
really rude. And so the energy you bring to the room, it just makes a difference, not just for this particular emergency we're managing, but every future one, how people are going to interact with you. So
Yeah.
sure, super important.
I think that like everything you've just said is important just for any interaction you have with anyone. I'm like sitting here like kind of flabbergasted at just how you've broken down what communication should look like for the NP at the bedside, in the office, in the clinic. Like, no matter where we are, everything that you just said is so critical to how we should be interacting with each other on a team. And so when I present to the physician, or when I am curbsiding something with one of the other and nurses or whichever, these are little tips and morsels that can play out anywhere and be very effective at kind of creating that collaboration in a team. And Sarah, one of the things I admire so much about you is that you do just have such a servant leadership heart, that when you walk into the room, your mission is to serve the patient, serve the team. And that's why you're the leader of the rapid response team at your job, because you really do walk in with that energy everywhere you go. It's so inspirational. And it's one of those things that as you were talking, I was thinking, how did you get these skills? Because these are just not skills you're born with. These are skills you cultivate. These are skills you grow. And yes, part of it is from your 20 years of experience, but has there been anything else that a nurse that's like, listen, or a nurse practitioner that's struggling, like, I don't really have those skills. This is really hard for me to do when I'm under the gun or under stress, to be able to immediately go into that mode. What would you say to that nurse or nurse practitioner?
Yeah. So again, these are things that I didn't learn in nursing school either. But I think that I'm a person that likes to reflect and debrief. And I've learned a lot from that as well. So like on my drive to work, I'm jamming out to music. I'm listening to favorite podcasts. Like I'm like getting in the zone, right? My drive home from work is almost always in silence. And that's very intentional. I want to reflect on my day and think about not just like the patients I served and like the nurses I interacted with, but also like, how did I perform? Like, how was that received in this particular situation? How do people respond to the way that I managed that room? Or how did that interaction go with my colleague? And I'm like dissecting all of it. Like, what went well? What was not so good? I think about other people and how they behaved. I was like, oh, I really liked how Joanne handled that situation. I'm gonna try. That's good verbiage. Which how she explained that to the family. I'm gonna capture that and hold that in my brain. Or like, oh my gosh, that one doctor, the way he handled that conversation about goals of care was horrible. I'll never do that. So I'm constantly like creating this filing cabinet in my brain of what I aspire to be and what I never want to do. And so that when it happens to me, when I get the opportunity to access those tools or resources that I've filed away, then I get to. And so the nurse that I am today behaves very different than the nurse that started out in 2004, right? I was, one, only 19 years old when I became a nurse. And
My
so
gosh.
I was like the baby of the unit. And it was very obvious. I was like 100 pounds and this little, I don't know. I'm still surprised they hired me, honestly. But the way I behaved back then, I'm very different now. It's been a lot of practice and mistakes and failures and like, okay, won't do that again. I'm gonna try it this
Yeah.
way next time. I've slowly learned how to do that. And just like paying close attention to my mentors and people I look up to and trying to like glean how they handle things. I remember there's this church nurse that I looked up to so much, Jack. He was a nurse for like 30 years prior to me becoming a nurse. So he had been doing this for a while. And just watching him in a code, he was just so calm, he didn't freak out. His, like, voice didn't really, like, fluctuate. He was just so I felt so much like, "Okay, we've got this." Like, Jack says we got this. I can tell from his body language, from his tone, "Okay, this isn't scary stuff. We can totally handle this." Versus him with this other nurse, Carol. Oh my gosh, her hair was on fire. She's, like, yelling at everybody, freaking out. And I remember thinking, "Oh my gosh, this is not going well." But it was probably the same exact situation as what Jack managed. It's just that what he brought to the room was so different.
Sure.
And so
Yeah.
definitely the way you behave is important. And I take note. Okay, Carol acts like this. I don't want to do that. Jack does this. I want to aspire to be that. So slowly filing that away. And then I've just read so many books and listened to so many podcasts about team leadership and communication and trying to adapt those communication styles to how it sounds like in Sarah's words, right? I'm not Jack. I'm not going to talk just like him. So, like, what does that sound like from Sarah? And eventually you kind of develop your own, like, script and responses and things that you can pull out easily.
Yeah.
And, there's all the times where I've interacted with a doctor and it didn't go well, or I've talked to the patient, it was not well received.
As healthcare providers, every single second counts, especially when you're making critical decisions. That's why nurse practitioners and physicians at every stage of their career rely on Epocrates. Epocrates is the trusted clinical intelligence platform accessible via app and the web to support healthcare professionals with access to indispensable clinical intelligence they value to make the best possible decisions at any moment of care, whether it's checking drug interactions, identifying pills, or assessing evidence-based guidelines. Epocrates provides the accurate, timely answers you need. Visit epocrates.com and apply offer code SUCCESS to their most popular yearly subscription plan to receive a whopping 20% off discount on your purchase. Again, that's epocrates.com, offer code SUCCESS. Epocrates is the clinical information you need at your fingertips. Picmonic is a quick and effective aid to help you pass your NP boards. They utilize 2-minute videos that connect difficult-to-remember facts with unforgettable characters. By tying facts together into ridiculously memorable stories, you'll be able to retain the information for test day. They help reinforce what you learn and track your progress with thousands of built-in rapid review multiple choice quizzes. The use of the intelligent space repetition algorithms automatically adjust to your learning needs, so you'll be reminded to review the right information at the right time, increasing long-term retention. Picmonic is also integrated into the True Learn question bank, so you can study exactly what you need and test your knowledge. Check them out today if you're preparing for board. Link in the show notes.
So then I'm like, okay, so next time I'm gonna do this differently. And I learned from mistakes. Like, I wish I would have said this. Okay, next time I'm gonna try to say this. And actually, I've collected all these things that I want to use and that I get to use at the bedside. But it does take time, and I think intentional practice. It may come a little bit naturally to some people, but it is a skill set to cultivate and to hone and work on.
This sounds like the debriefing that you do is
Mhm.
a personal thing, but some places do this as a group. Like after an event occurs, they all kind of sit around and talk about what went well, what didn't go well. And I think that like some hospitals, I don't know if your hospital setting does this,
Oh, yes, we do.
after events, you kind of
Mhm.
have this debriefing of
Mhm.
what went well, what didn't. And would you say the hospital culture plays a really big role in how much of this kind of breakdown of what can we do better? How can I change? How can I grow? Plays a big role in the nurse NP relationship during critical events?
I think so. I'm really lucky that our hospital culture is a pretty safe culture in that when people make a mistake, they're not like penalized. Rather, it's just a teaching opportunity. There is that culture of like, let's learn together, let's grow together. The whole debriefing process. I remember when I first started the rapid response team and I said, let's debrief. People were like, oh no, like, what did we do wrong? Oh, no, no, no. The goal of the debrief is actually to celebrate our wins, to point out the good
Yes.
things. So we keep doing those things. And if there's things we can learn from it, okay, let's do that too. This is a great opportunity to learn, but it's never the vibe of like, all right, Joe sucks at compressions and, Tamisha didn't document very good. And like, no, we're not bashing each other. We're
Yeah.
talking about how can we grow as a team. And so once people started realizing the culture was shifting, this is not punitive. The goal is to celebrate. The goal is the kudos, right?
Yeah.
People love that. People love kudos. And so I'm like, hey guys, what I usually say is, I'm going to get this patient in the ICU. I'm going to come back. I wanted to talk to you guys about some things I saw that went really well. And so like, oh, I can't wait to hear like what went really well. Like, oh, am I one of the ones that she wants to mention? And so I come back for the debrief and I start with the good. I'm sure you've heard of the sandwich method, right? I mean,
Yep.
did they teach that at
Good,
MP school?
bad, good. Yeah. Yeah.
So
Yeah. Yeah.
you start with, "Hey guys, what went well? I noticed this. I saw this. Oh yeah, you're right. They did do that really. So kudos, kudos, kudos. As many as you can get out there, right? And then you move into, all right, those I agree. That was awesome. There probably were some things we could do better. What did you guys see that could have gone better? It's not what did we do wrong? What's the mistakes we made? It's just what are the opportunities that we can learn from? Talk about those. And never pointing out one person. Like let's say Joe was bad at CPR. I'm not gonna say Joe sucked at CPR. I would say and notice the compressors were getting tired. Let's make sure that we're swapping out compressors more frequently next time. Or I noticed that Sarah was struggling with compressions because, y'all, she's short. We need to make sure we have that stool available for future emergencies. Like we need to have a home base for that stool so it's easy to access, or whatever the thing is, right? So pointing it out, not like saying this one person sucks, but as a team, as a system processes, how can we improve? And then I always end the debrief with, all right, thank you for this. Strong work on this. Great job on this. How can we support each other moving forward? Do you need help get this patient settled in 35? Can I help you clean that? You want to pass mesory? How can we support each other? And that vibe feels very different than, all right, you should have done this, you should have done this, you stuck to this, and you stuck to this. Any questions? Nobody
Yeah.
wants to attend that. Nobody wants to go
Yeah.
to that kind of debrief. And so I think debriefing yourself in the same way. What did I do well today? Who did I help today? Who did I connect with today? Anything I could have done differently today that would have made a better impact or connected more with people or made more sense or been more clear, whatever the thing is. And then, okay, like kind of giving yourself some like gratitude, like, okay, like great job, Sarah. Who does on this? You did good on this. So debriefing yourself is just as important as debriefing with the team.
Yeah. And I think that each NP for their just daily interaction, again, no matter what setting that they're in, this is applicable, right? So going through, and I do this with my own self when I go to work, I think like, oh, when you become a mom and you're busy, it's kind of hard to sit in silence. There's really not a lot of moments of silence, but like you said,
Except for that drive home.
except I was gonna say, finding those little pockets of time when you're just like, all right, I'm here. What went well today? What didn't go well? I talk a lot about that in one of the booklets that we created because I think that being able to reflect on how you're growing or not growing or what areas that you need to get better at is tantamount to improving yourself over time. I just think that's so applicable to any NP listening today. And then how do you see, so you've interacted with rapid response nurse practitioners on the field live, and I know there's some that have come on your podcast that you just think are fabulous people. You've described them to me as just they're just so capable and they impress you a lot whenever you describe some of them that you've met. So, what would you give to a new NP that's thinking about becoming a rapid response nurse practitioner or being a part of those teams that you're saying, hey, listen, like this is just something that I've seen as a thread in each of them that distinguishes them as great or a cut above all the other ones that I've interacted with?
Sure. So I think that the transition from being a bedside nurse to an NP, I'm sure it's difficult. I haven't experienced it personally, but I've watched so many of my colleagues go through it. I know one of my good friends right now, she just finished her DNP and she's starting next month as a nurse practitioner in the ICU. And during her clinical time, she said the big struggle, the thing they kept having to like correct her on, is she's so used to jumping in and doing the thing, doing the task. Let me help out and give the med. Let me get the patient on the monitor. Let me do, because as nurses, that's what we do. And her preceptor's like, no, come back over here to the computer. We need to review these labs and figure out what to order. We need to look at the x-ray and make sure that this is the right treatment for this patient. Like, take a step back. And it was so hard for her to transition from like, no, but I want to help. I can help real quick. Just like, and she said, but if she did those things, then she's failing the team by not getting to the bottom of the diagnostics, not treating the patient appropriately. So that was a hard transition. I mean, I'm sure she's figured it out now, but that was like the constant thing that came up in her clinicals was like, no, I know you can do that. I know you're so used to doing that. You're good at it. But right now, you're transitioning to a different role in healthcare. And so I think reminding my NP colleagues of like, I don't expect you to give them heads. I don't expect you to, you're not documenting. Like what I need you to focus on is your expertise, which is diagnostics. Assess the patient, do the diagnostics. I will cover the basic stuff, right? You don't have to remember, oh, it's been 3 minutes. It's time for epinephrine. Oh, we need to pause and check a pulse. I got you on that. I've been doing ACLS for 20 years, right? I will cover that. Get out that ultrasound. Figure out what's wrong with the patient. Review the labs. Talk to the family. Do what you got to do. Use your intelligent NP brain to figure out what's wrong with the patient, and I will keep the recess going. And I think that's such a hard transition when you're used to being the one that's giving the meds and you're used to being the one that's scooting the patient up in bed. I mean, and if you have time, sure, you can help with those things. I think that's great for morale, but I don't actually expect you to do those things. To me, that's not what makes you a good NP or not. I think it's you do have to take some time to like transition your role towards diagnostics. So I would say the message to you is know that as a rapid response nurse, I am capable of managing this room, of keeping the recess going. I want to give you space to focus on the diagnostics. So however I can help with that, If you need to do like some cognitive offloading, like, hey, make sure that we get x-ray coming, make sure that you're using closed loop communication. So you want to hear me say back, I'll call x-ray. Or if you say, we need to get an EKG, wait till someone says back, I'll call for the EKG. We need to get I don't know, an H&H and a lactate, make sure someone repeats back that it's being done. Because you can say it all you want into the abyss, but unless someone's actually doing the thing, it's not going to get done. So making sure that closing the loop is happening, that's a really important skill set. But I don't expect you to be a bedside nurse. You've transitioned to a new role, you have a new expertise, and I'm relying on you to do that well. And you just have to trust that I will manage the other stuff as well.
Yeah. And again, like I'm saying, it's so applicable to other settings. Because even this week at work, I had a situation where a nurse had brought something to me. And again, like you said, it's my job to be able to assess what's going on, figure out if there more tests need to be ordered, like different things like that with a patient. And I reached out to a nurse and I said, hey, could you get all this information? Like, whatever. And I waited for him to kind of follow back up and he never did. And kind of like what you're saying, like, you've got to go close the loop. That's my job. Like, and again, it's not an acute care thing. So I don't have the pressure of right then and there, but you bet your bottom dollar the next day I had said, did we call her? Did we follow up? Did we make sure that these things got done? And it was like, yeah, yeah, yeah. And I'm like, is the documentation in the chart? Like following up with those things, that's applicable in the acute care setting, in the outpatient chiller, not acute care setting, because again, that's our new role. And it's not my job to necessarily do that thing, but I'm still responsible for it. And so, kind of like what you're saying, you've got to kind of get that team approach, work on closing the loop. Did we do that? Yes, we did. Great. Did we do this? Did we follow up? Great. And so I can close that up. And you've got to do that in any setting as the NP. And then it's just interesting to hear that that is the transition glitch. That's the tough part for the nurse going to the NP, is just you've got to step back from the bedside and you've got to get on the other side of the computer and figure out what's going on. And that's hard. That's really tough. And yeah, I think that's really
Mhm.
great advice. Sarah, where do you see the future of rapid response going for the NP collab? Like, what is stuff that you say, you know, where does this go when you extrapolate? This is where I see the team moving. This is where the vision of what I have for the most synchronous relationship between the nurse and the practitioner at the bedside. What would you say?
I think we have a good mix right now. My ideal rapid response team would be a bedside nurse with critical care experience, a nurse practitioner with critical care experience, and a respiratory therapist. We could change the world. There's those three disciplines showing up to emergencies. That's literally all that you need. We could totally
Yeah.
handle any emergency. I've asked for that at my hospital. Unfortunately, we're a teaching hospital, and they're like, no, the residents need practice
Yeah.
and
Yeah.
emergencies too. So I was not granted my wish, but to me, that would be ideal. So in my hospital, there is a nurse practitioner that works in the ICU and residents, and they rotate every other emergency who responds. And so I get to respond with residents and I get to respond with the NP. I'm sure you can imagine how the vibe is very different when my
Yes.
buddy, the NP that's been in critical care for 10 years, shows up versus this resident. The residents are great. Honestly, I love working with them,
But
but they
there you go.
definitely are much more scared and timid and maybe not as familiar with emergencies as, say, the NP that's been doing this for a while. So that'd be my ideal. As far as where it's going, I don't know where it's going. I think
Yeah.
that's going to be dependent on so many factors. If the hospital's a teaching hospital, finances, all those things. I will say, though, it's been really cool to work with all these nurse practitioners that I've worked bedside with the years, and now they're working on specialty teams. Like I have friends that work with oncology now, they work on the neuro team, they work on the stroke team, they work in cardiology, they work in GI. And because they know me already, sometimes I'll actually get like almost like a consult from them. They'll call me like, hey, Sarah, I was consulted for this patient's GI bleeding, but let me tell you, there's a lot more going on. Then you probably should come lay eyes on this patient. Like
Yeah.
I do not feel good about them being on the med surg floor. Or they're like, hey, they called me, there's a cardiology consult, but this patient's in septic shock. You might want to come look. And I think it's just a reminder that, like, yes, they're focused on like their specialty. They're really good at that now. They've been doing that for a while, but they still have nurse spidey senses. They still know like something's up with this patient. This is out of my realm as the consulting provider. but like, I'm gonna need somebody to address this. Sarah, can you call like so
Yeah.
efficient? I get those calls, I kid you not, 2 or 3 times a week from my NP friends who are now working in specialties that are finding these patients from consulting services that need a little bit more TLC, a little bit more tweaking, a little bit more advocacy. So I'm happy to come alongside those nurses and support the patients that they're caring for, even if it's not in a way that, is specific to their practice or their specialty now.
Yeah.
We're here for that too. So
You're so incredible, Sarah. You really are. Just hearing you talk and hearing how your perspective on things is just, again, like I said, that's why I like you like try to shake me. And I always call you like, hey, where are you, Sarah? I haven't seen you. What are you doing? I saw this or that. And you're always like, oh, wait. Like I just think you're so inspirational. You're so cool. You've just got such a great way of putting things and just putting it in such a way that everyone can understand it. Everyone can grasp what you're trying to say. It's so nice to hear you talk. And I do agree with you. I think that nurse practitioners at the bedside and that stable role, I just think is so important. I think that there's so much education backing for the resident that sometimes I get a little frustrated as the NP because I'm like, I'm going to be here for 6 years, 7 years. He's going to go in 2 or 3. Like they'll be gone. And by the time you finally get them to where they are, that calm MD at the bedside, they're gone, and that nurse practitioner that sometimes I feel like the hospital culture doesn't really want to invest in maybe, or, the institution doesn't really see as important. It's like, no, if you invest in this NP and you let her grow, she can run the clinic or run the office or run the floor, whatever it is, because she's had that continuity. She knows what to expect. And so I think NPs kind of need to hear like you're super valuable. The nurses see that you're valuable. The other staff, that consistency that we are, I think goes a little undervalued because it's just they're expected to be there. And we don't think that we're that valuable because there's so much energy put on, we have to get this person ready to go out. And it's like, yeah, but I've been here. So I think that's kind of an interesting maybe topic or thing to kind of consider for the future of what NPs are needing maybe to advocate a little strongly. Like, okay, yeah, I understand he needs the education. So do I. Like we both do. Well, Sarah, this has been so much fun chatting with you. I've had an absolute blast. Please tell me where people can find you and yeah, tell me all your things.
sure.
Yeah.
So I too have a podcast called Rapid Response RN. You can get it on any podcast player.
Love it.
It's
No,
not just for
no,
rapid response nurses though.
no, it's not.
Really, the goal is I want to share every kind of emergency you can think of, but I share it in the form of a story. So like, here's how I found the patient. Here's what we knew in the beginning. Here's what we discovered. Kind of like unfolding the story. And I think from the case study is the easiest way to break down the pathophysiology, the pharmacology, the nurse's role, even like the NP's role in managing this particular emergency. So if you want to hear literally 130 different stories, case studies, and how to respond to them, that is my podcast. And I love telling stories. I love teaching complex concepts. There's probably a podcast on whatever crazy emergency you can imagine that you might encounter in your workplace. So I hope that serves the nursing community, whether bedside nurses or NPs. There's also like pharmacists that listen to my podcast and physicians and like
Yes.
a lot of the residents in my hospital. They're like, "Oh, Sarah, that last episode you did on serotonin syndrome, that was so good." I'm like, they honor that the residents also listen to my podcast too. But yeah, it's there just for healthcare professionals that want to feel more confident responding to emergencies. And then if you are a visual person, I have an Instagram. I'm the rapid responser on Instagram, not because I'm the only one, but because whoever claimed rapid responser RN before me and I couldn't have just claimed rapid responser RN. So I'm the rapid responser RN.
The
So that's how
title
you
is
can find me.
appropriate. I think the title's appropriate. The rapid response. All right. I love it. And what were you going to say? I cut you off.
I think that's it. There's
Yeah.
a podcast. I mean, I'm on Facebook, I'm on TikTok, but I never actually
I know.
post anything there. I think the last thing I posted on TikTok was like 3 years ago. But
Yeah.
if you really want to find me on TikTok, you can find me there. Instagram is where I'm most active for sure.
I actually listen to your podcast for that exact reason that the residents do. Because I'm in the outpatient set. I never see any of this stuff. And so I like to listen to your podcast because I'm like, oh my gosh, like I didn't even know this was something that, I mean, one of the ones I listened to, I love your story on the Foley that got kinked and the guy was there was something, refresh my memory. So he had a Foley, got kinked, and he started developing some syndrome. And I can't remember what it was. Oh, something with his blood pressure went down. And
Oh, Well, dude, now I can't think of it. Hold on. It's where patients who are paraplegics and they have
Yes. Yes. No, I can't remember what it was, but it was so interesting.
autonomic dyslexia. Just took me a second.
I listened to that episode. I loved it. And so, like, again, even though I can't remember the term, I do remember just being like, you were like, I just repositioned the catheter and like he started feeling a little bit better. And I was like, stop it right now. Like just you're genius. And when you're in flow and you're doing your job, it's just so cool. And then you share it. I just love it. So we do rapid fire questions, not rapid response questions, but we'll call them rapid response questions today.
Sure. All right. I love rapid. Let's do it.
So what is your favorite beverage?
Boba tea. Hands down.
No, this is about you.
Girl, I love boba tea. Oh my gosh, it makes you so happy. It's such a fun drink.
Noted. Okay. And then what's your favorite season?
Fall.
I feel like I was going to guess fall for you because I know you're just like, you're into your like, I don't know.
Cozy, man. I love the cozy of fall.
All right. And then my last question is, because this is the Success NP podcast, I want to know what it is for Sarah to feel like she's met the definition of success for her life. What does that look like? And I know this isn't a rapid response question, but it is one that I feel like in the vein of what you were talking about earlier, like I just like to go deep. And that's one of the things I like about you too, Sarah, is just that your depth of thought and your depth of reflection, I think is emblematic of a lot of things that you and I mutually agree on. But I wanted to hear your perspective on this because I'm like, if that's what we're chasing, if we're all chasing success, that looks individual. And what is that for Sarah?
I think it's hard to say as like one thing, but generally speaking, I would say if I get to a point where I feel like the way I spend my time and the way I spend my money, the way I spend my thoughts is in alignment with my values, that is success. So for example, if I value my family, but I'm working my butt off and never get to see them, well, that's not really in line with my values. You know, if I value serving others, but I spend all my time serving myself and focusing on myself, that's not really in alignment with my values. So if I can get my life to a point where the things that I value is reflected in how I'm spending my time, my money, my resources, my brain space, I would say that is success. It has nothing to do with finances, has nothing to do with things that I own. All that stuff is, pales in comparison to what I value in life, which for me is time with people, making an impact on their lives, showing people love, like sharing compassion. I want my purchases, my thought space, the way I spend my time to be in alignment with that. I could go a lot deeper than that, but that's like the overall. So when perfect. I'm looking at my finances, when I'm looking at my calendar, when I'm looking at how I'm spending my life, I want to make sure that I'm tweaking it to actually line up with the things that are important to me.
Yeah, that's deep. That's deep. That's like, I know that's superficial for you, but that was deep. And thank you for sharing that because I echo everything that you just say. I agree with you 100%. Yeah, it was beautifully said. Beautifully said. All right. Well, guys, thanks for coming to hang out with us at the Success NP podcast, and catch you next time.
All right. Adios.
Adios. Thanks for tuning in to another episode of Success NP. We hope today's discussion has shed some light on the diverse career options or taught you how to improve your clinical practice as a nurse practitioner.
Remember, whether you're considering a specialization, pursuing advanced certifications, or exploring non-traditional roles, there's a wealth of opportunities out there waiting for you. Be sure to subscribe to the show so you don't miss an episode and leave us a 5-star review. It helps the podcast grow. The Success NP's podcast is on the World Wide Web, YouTube, Instagram, Facebook, and X. So subscribe to our newsletter for updates on new podcast episodes and other information to help you on your own NP journey. You can always message us at successnpspodcast@gmail.com with any NP podcast episodes or topics you'd like us to discuss.
Until next time, take care. Stay curious and keep advancing your careers as a nurse practitioner. And just a friendly reminder, the information on this podcast is for educational purposes only. The information should not be used in substitute for professional care by a medical provider. The information on this podcast does not represent medical or professional advice or services.
Bye for now.